So I thought I'd make a wee video this week on what you can expect to leave hospital with after your stoma surgery. And what I was given was this, a stoma care bag. And in your stoma care bag, you'll have all of your stoma bags and all of the supplies you need to leave hospital and look after your stoma yourself and get on with your life. But before I go through the stoma care bag and all the contents in it, I just want to quickly go through this, which is the training pack you'll get in hospital before your surgery. And they'll probably give you this training pack about a day or two before your surgery, and in it there is a little fake stoma, so you can stick this onto yourself, walk around, kind of get used to what it feels like and looks like to have a stoma. There is also a bunch of stoma bags, so you can put the stoma on, you can put the bag on, and you can practice bag changes and bag emptying. And as weird as that sounds, that's actually something I did quite a lot of the day, 2 days before my surgery, just because I was so bored, and I do think it really helped me when it came to actually changing and emptying my bag. I've heard some horror stories of people changing their bags first up in the hospital and it being pretty disgusting and pretty traumatic, so I do really recommend sticking that stoma on you, putting this bag on, taking it off, just getting used to how it feels. And finally, in the introduction box, you'll have a bunch of leaflets which basically just walk you through what it's like to have a bag and explain to you how you change it, explain what the stoma should look like, what sort of foods you should be eating, that sort of thing. So first up, the stoma care bag. I got given this one. I didn't really get any choice. I think it's pretty smart. I've not really felt the need to change it yet. It's pretty basic but pretty self-explanatory. It's got this nice hook at the top so you can hang it on the mirror and do all your bag changes easily and have everything in here. It's got a few nice little pouches, but yeah, basically it's a pretty simple bag. You could probably just use any sort of wash bag or a boot bag if you don't like the one that the hospital gives you. So in the stoma care bag, you will have a bunch of these clear stoma bags. And I have to admit, it was pretty worrying when I first got the stoma bag and I realized they were all clear fronted, and I thought, I really don't want to be looking at this thing sticking out of my belly, crapping everywhere for the rest of my life. And I was really hoping there'd be something more discreet than just these. But the reason the hospital give you these is so that you can keep an eye on the stoma, you can keep an eye on the output, and just make sure everything's running smoothly for the first month. Don't worry, because in another video that I'm filming, I'll show you how you can get in touch with all the stoma bag companies and get samples of different stomas in different colors, shapes, sizes, and you can have something that's a bit more discreet and a bit nicer to look at than these. Secondly, in the stoma care bag, you'll get one of these, which is a stencil. I'm not sure if you can see it there, but basically use this every 2 to 3 days after you come out of hospital just to measure the size of your stoma. Because in the first sort of 6 to 8 weeks after surgery, your stoma will change shape and size a lot. I've noticed mine has changed shape and size an awful lot, especially when I've gone through blockages and stuff. And by measuring your stoma on a regular basis, you can cut the shape of your stoma bag so that it always fits and you don't have any leakages or any discomfort. And in order to cut the shape in your stoma bag, they give you a pair of these scissors, which I guess are just nail scissors, but they are nice and curved, so it's really easy to sort of cut a nice circle in the bag and make sure that there are no jagged edges that would otherwise stick into your skin or your stoma and cause loads of discomfort. In the bag, you'll also get some sort of adhesive remover. So mine is a adhesive remover spray. I know that you can also get adhesive remover wipes, so if you don't want to use this or you're going abroad and you're only taking hand luggage and can't take this, I would definitely look at getting some of the adhesive remover wipes. But basically what this does is it removes the bag from your skin. The bag is stuck to your skin through a very sort of strong adhesive, and by spraying this around the bag, it allows you to easily peel the bag off your skin without causing any irritation or any skin problems. You will also receive a bag full of wipes. So when you take your stoma bag off, you'll basically wipe around the area with these wipes, clean it all up, get rid of any gunk, any sort of poo, and throw that in the bin. And it just means that you're always keeping the site clean and, like with everything else, making sure that you avoid any skin problems. And once you're finished with those wipes, you will throw them into one of the bin liners that you're given in the bag. So what I do is I take off my stoma bag with the adhesive remover, I wipe around the area with the wipes, clean it all up, take the wipes and the stoma bag and throw it in this bin bag. and then when I'm done with the bin bag, tie that up, throw it in the main bin, and then it's someone else's problem. You'll also receive one of these, which I've not actually had to use yet, but it's basically a little handheld mirror. So basically when you're changing your bag, it's always quite nice to have a mirror in front of you just so that you can see the whole area from the front, make sure that you're cleaning it up properly and that everything looks normal. But I just do my bag changes in front of the big bathroom mirror, and I've not had to use this yet. But I guess if you go traveling, go backpacking or anything, then this might come in handy. Another thing you'll get in the bag that I've not had the chance to use, but I'm really looking forward to, is the radar key. And this is basically just a master key that gets you into disabled toilets all over the country. I think it says it gets you into 9,000 toilets. So I guess if you're out and about and you desperately need to change your bag, or you have a sort of accident going on there, you can pop into Pret or Costa or wherever and use that disabled toilet that's normally locked. And finally, I was given a tube of Aura Base in my bag, and that's because I had a little problem around my stoma where the skin wasn't quite attaching. And by applying some of this to that area, it basically helps the skin connect to the stoma. You won't always be given this. You'll only be given this if you have a specific problem, but I suppose whatever problem you do have, hospital will give you a plentiful supply in the bag. So just make sure you speak to hospital whilst you're in there if anything pops up, and they'll give you the right thing. So I hope you find that somewhat helpful if you are planning on having a surgery soon and you're wondering what you're going to get given after you leave hospital and how you're going to go about with living with the stoma and changing your bag and all that sort of stuff. Like I said, I've got another video coming all about the different bags that you can order from manufacturers, and I'll do a little video where I try them all on and I sort of go through the pros and cons of each one. Please feel free to share this video with anyone you know who's got IBD, Crohn's, colitis, or is looking at having stoma surgery. Hopefully it might help someone or put their mind at ease a little bit, and please stay tuned because I've got plenty more videos all about Crohn's and stoma life coming up.